Welcome to the World Institute of Critical Care and Emergency Medicine, a non-profit educational organization built by physicians for physicians with a mission to improve global healthcare. Our goal is simple: to help healthcare professionals around the world make informed decisions, enhance critical thinking, and excel under pressure, especially in high-stakes, critical, and emergency situations. WICCEM offers comprehensive training and resources in critical care and emergency medicine, featuring a core curriculum that covers adult and pediatric care, with courses in pulmonary, cardiovascular, and neurology specialties. From advanced training in emerging techniques to hands-on experiences in critical care, life support, and emergency medicine, our programs are designed to equip you with the skills needed to thrive in demanding environments. Our expert faculty, who offer lectures, mentorship, and innovative insights through annual conferences and webinars. With our online learning platform, you can access courses, workshops, and a rich library of resources from anywhere in the world, making education accessible no matter your location. WICCEM also provides certifications and CME credits to support your professional growth and ensure you stay at the forefront of the field. We also foster a global community of healthcare professionals dedicated to advancing the field and improving patient care worldwide, especially in resource-limited settings. Join us at World Institute of Critical Care and Emergency Medicine, where we empower you to make a lasting impact in healthcare.
Hello, everyone. Very nice to see all of you today. It's fantastic webinar as usual. The Intensive Care Nutrition Fellowship is very innovative, one-year online program with gathering a lot of expertise in the field from all over the world. And it's actually cultivating the next generation of leaders in the field, equipping those who need advanced knowledge and skills and experience, especially in acute care nutrition settings. The ICN Fellowship is committed to provide rigorous interdisciplinary curriculum that encompasses both didactics with a lot of clinical case scenarios, journal clubs, MCQs, and lectures. The Intensive Care Nutrition Fellowship is tailored to meet the diverse needs of all healthcare providers, not only the physicians, but also nurses, dietitians, pharmacists, and every single one who works in the acute care setting and need to get better understanding how to manage the nutrition in acute settings. It's really unique program. You wouldn't find such program in the whole entire world that give you this high quality, well-structured educational information for a whole year with a fellowship that is accredited by the American Association of Continuing Medical Education for 96 credit hour. So really, I congratulate Dr. Khaled, Dr. Wafa, Dr. Mirey, and their team. And I know that they have very, very competitive and strong board members and faculty in this program. So without any further ado, I like to introduce my dear friend and colleague, Dr. Khaled Swifi, who I know for several years now. We started together by creating the critical care nutrition program that was very successful. And he showed me his talent and knowledge and connection and the passion for education. And today he's going to lead this very nice intensive care nutrition webinar with a panel of expertise Dr. Wafa Aish, and Dr. Miri. Please, Dr. Khaled.
Thank you, Dr. Am, for introducing me and for your leadership. We are learning from you always. I'm very happy today to introduce the fellowship as the final webinar before starting 25th of June, and the platform will be ready on July 7th. So let us to take a look at our fellowship. So our fellowship is hosted by World Institute of Critical Care and Emergency Medicine. And the unique about fellowship is actually have two different flavors. So we are talking about nutrition extensively, and at the same time, we have a flavor of critical care. So how to deal really with critical ill patient from all aspects, and of course, we'll focus about the nutrition. Our fellowship also will tackle both adults, pediatric, and neonates. So it's unique all over the world. And to my knowledge, maybe there is only one online fellowship competing with us, but no other fellowship in the world having a high quality online teaching over 1 year. And the syllabus is very unique, composed of 3 modules. And I leave Wafa to speak about it in detail. The program has been completed, and we are ready on the platform once you are starting the fellowship on July 7th. So the team is diverse. So we have intensivist, we have internist, we have endocrinologist, we have GI physician, we have clinical dietitians, very expert in the field of critical care nutrition, as well as we have a clinical pharmacist who work in critical care and very expert in parenteral nutrition. So and all are in adults, pediatric, and neonates. So it will be very, very informative to go through our fellowship program. Our members are present on our site. We are going to add every time when we find somebody expert. We found a new member here who is a leader of neonatal critical care in Saudi Arabia, Dr. Ali Al-Mudir. We added Dr. Ismail from Palestinian dietitian. He's actually is very, very expert. He's leading the dietitian in Palestine. So is also Dr. Subhal is the director of the Indian intra and parental nutrition. We have a lot of newcomers. When we found somebody really high quality and interested to teach with us, we are actually involving them. So we are continuing marketing through the mini platform, but I would like to tell you that we have around 3 modules, 96 credit hours has been accredited by the American Association of Continuous Medical Education by 96 credit, which will be very great over 1 year time. You can find us on LinkedIn, social media, MailChimp, and we conducted many webinars. The first webinar, we talk about novel nutritional therapy in renal patients. Second, we talk about critical care oncology patients, and third, about renal transplant. And fourth, last webinar, we talk about GI nutrition. Also, we give certificate of attendance to candidates after attending our webinars. And today, the webinar, I will speak me and Wafa and Mireille, and we will try really to summarize what we are going to have in our fellowship program. Also, I have a good news for you because there is no any promo code available. We will give, because of this webinar, it's final, we'll give 15% discount over 2 days, June 16 and June 17, if you use the promo code webinar15. So you can get an extra 15% discount to encourage you really to join our fellowship. So next step, we would like you to register and to pay if you did not start, because this is the final webinar, and we have the induction meeting on June 25 and very difficult after that to register in our. You need to stay for 1 year until you're able to register again. Timing will start July 7, 2025. Please just be with us. We are learning from each other. We have very high quality teaching. We have a very high quality leaders and instructors, and don't miss this opportunity. Registration is clear. You'll find here the link, and I'll write it in the chat box as well. And you can look at the landing page if you want to learn more about the fellowship, and you can get the chance of using the webinar 15 discount before it will expire after 2 days. I'm always telling that you have to learn the role of the game, and then you have to play it better than anyone else. And this is the only way to be successful, to have a knowledge, because knowledge is always power. I will leave you with video talking about the fellowship in a few minutes, and later on I'll give the mic to Wafa to speak about the speakers, the instructors, and the syllabus and timetable. Thank you very much.
Discover the next level of critical care expertise with the Intensive Care Nutrition Fellowship, a phenomenal program for aspiring professionals in the field. With the increasing importance of nutrition in critical care, this fellowship fills a crucial void in training. It's not just a program, it's a deep dive into advanced clinical nutrition knowledge. The fellowship covers everything from basics to advanced concepts of nutrition for adults, children, and newborns, tackling questions about various critically ill patients across different specialties. This includes medical, surgical, cardiovascular, renal, hepatic, oncological, transplant patients, and more, encompassing both enteral and parenteral nutrition. Upon finishing, attendees will be capable of confidently and securely formulating and managing any related complications. Join the fellowship to reshape healthcare and transform your dedication to patient care into a leadership role in critical care nutrition. Whether you're a beginner or a seasoned professional, this program offers the perfect platform for growth. Your path to becoming a healthcare innovator is just a step away. Don't let this chance slip away. Embrace your future in critical care nutrition with the Intensive Care Nutrition Fellowship. Your journey to becoming a healthcare hero starts here.
Okay, so we are going to answer your question at the end of the session, and of course you can leave your question in the chat box if you want to ask anything about the nutrition fellowship details. I leave the mic for Wafa to speak about the syllabus and timetable.
Thank you, Dr. Khalid. Good evening, everybody. I'm just going to share. You can see my screen? Yes? Can you see my screen?
Yes.
Yes, we can.
Very good, excellent. Okay. I'm honored to be with such amazing galaxy of speakers and to show this fellowship in the critical care nutrition, which is very, very important actually, and I'm honored to be part of it. I'm gonna just quickly, of course, now every day Dr. Khalid add one star. So these are preliminary, the one which a lot of changes had happened, but that was at the beginning. Now Dr. Mirey is our program director. And these are our stars, and more have been added, as Dr. Khalid have said. Okay, I'm gonna talk about the modules, and we have 3 modules. Started with the first module, which is the foundation of the ICN, introduction and the basics of the part 1 is introduction and basics of principles, where we have more than one lecture to be there. First, in the week 1, Dr. Khalid Swayfi will talk about the introduction to intensive care medicine, ICU equipments and instruction. And he will take us for a journey about the intensive care medicine, the ICU, how it is equipped, these tools, what's supported to be done, and what kind of multidisciplinary team will be there in this ICU in the intensive care medicine. Then in week 2, I will be giving the talk about the assessment, calculation, and monitoring patients for malnutrition and how to feed the obese critically ill. And I will focus on how to manage the nutrition in obese critically ill patients who really needs careful assessment to prevent malnutrition, and all of these to be adjusted with evidence-based strategies. Followed by that, for week 3, we have 2 stars. The first one is Dr. Mirey Caravetian and Dr. Carla Brado, whom will take us in a tour for the hypercatabolic challenges, sarcopenia, and critical illness, and the importance of meeting the high protein target, both of them. And they will take us for a journey about the critically ill patients, their experience for hypercatabolic status, the loss of lean mass, and how it's very important and timely and adequate protein should be there. They will go in depth for that case, and they will give you all what is related to lead you for the best information. Going from that, for week 4, we have one excellent professor who is really, I love the way he talks, Dr. Amir Matar. He's the very amazing professor who will take us in a tour for optimizing EN prescription, precision, trophic feeding, and refeeding syndrome. And he will say what is the optimizing enteral nutrition, what is the trophic feeding, why it is very important to have a close monitoring for these patients, especially for the minerals and for the vitamins. From that, we will go for week 5, where we will have Sweet Ahoud, who is from UAE, will take us in a case presentation. She's very expert now in that calorimetry. She will give us a workshop, how the calorimetry is done and how to use it, what is the benefit of it. This indirect calorimetry now, it is a very important tool. It's a gold standard for determining the resting energy expenditure. And this method, how it allows to give you exact individualized precision and prescription. And I think you will enjoy that workshop. Going from that, we go for the second topic, which related to the GIT challenges. With week 6, we will, we will start with week 6 with my friend Iman, Dr. Iman El-Hannani, and she will talk about nutrition in acute liver failure and acute on top of chronic liver failure and acute pancreatitis. In that, she will take us a journey, what is the acute failure, why early nutrition is important, what kind of energy to be taken, and then from that, she will go to the acute pancreatitis and how the feeding can be initiated, when it is initiated, and how much we should give from protein and what are the goals. Going from that, we have an excellent speaker she is a gastroenterologist as well as a physician nutrition specialist, a professor from Alberta, Professor Lee Gramish, and she gonna take us on a tour about the feeding in short bowel syndrome and the micronutrients deficiency in critically ill. where she will talk about that CBS, the short bowel syndrome, the nutrition goal, the parenteral nutrition in that case, the nutrient absorption, and the important thing, because it have a problem, they have micronutrients deficiency. And she will take us in a very detailed how to deal with those cases. From that, we go to Sweet Reem. Reem El-Hawari, she's a senior consultant nutritionist, and she will talk about the nutrition in complex inflammatory bowel disease, managing feeding intolerance and small bowel feeding. And from that, she will speak about those patients, their enteral nutrition, which is preferred in that case, small bowel feeding, the nutritional management, and the most important thing with those, monitoring, and definitely, which with everybody, individualization to prevent any kind of malnutrition. Going to week 9, and you can see my smile. My dearest sister and friend, Professor Mireille, and she's a professor of nutrition in Toronto. She's gonna talk about different types of enteral formulas, glycemic control during critical illness, and the role of probiotic. Now it's the trend, huh? So she will take us on the various enteral formulas, how important and vital the glycemic control and the formulas with the low glycemic index, and why they are helping to stabilize the blood glucose, the probiotic, which she will show us that it is definitely supportive role in critically ill patients, and how it is used as individualized. From there, we go back to Dr. Amr Matar, who will show us a case presentation about the EN description and how to prescribe it, case discussion, enteral protocol. What is the prescription, that is case discussion, the EN protocol, as well as the protocol itself. From that, we go for the topic number 3 in the first module, which is pediatric and neonatal consideration. In that case, in week 11, where the expert, again, my dear friend, Dr. Fatma Al-Haddad, chief dietitian in the government hospital, she will give us a talk about the EN prescription, assessment of the nutritional status, when to use the EN in the pediatric, how to assess them, what is the formula choice, the route of feeding, the method of feeding, and definitely the monitoring. And again, it's individualized. From there, we go to my dear friend, Crystal, and she's an assistant professor in Beirut, in American University of Beirut. She will talk about the inborn error of protein metabolism latest updates. And she will show us what kind of updates, which include the expanded newborn screening, the advances, the integrations, how early the diagnosis will be as a lifelong nutrition therapy and supportive. From that, we go to my dear ex-staff, actually, Iman Farouk. She's a senior pediatric clinical dietitian. And she will talk about the different types of enteral formulas for pediatrics and neonates critically ill. And Iman will take us about what are the main formulas, like standard, semi-elemental, elemental, disease-specific, high energy, high protein. It depends. She will explain each one of them and when to be used. Week 14, go back to my dear friend Fatma, and she will give us a case presentation discussion webinar talking about how to prescribe. We spoke about the diseases. Now she will show us how to prescribe the EN case discussion and the EN protocol in pediatrics and neonates. And then we come for the first moment, which is very important, the module 1, week 15 and 16, semi-final assignments for you guys, and then followed by the exam. We'll have a break a little bit, going back to module 2, which is the principle of TPN. We finished the ICU and the GI, now going for the principle of TPN. Start with Dr. Muna Islami, and she's a clinical pharmacist in King Faisal Hospital. She will give us an overview about the TPN timing, indication, contraindication, complications, and then she will talk about when to be given and what kind of things that it could go, where, how, like initiation in 7 days, indication for that, why, when we can't use it, what are the complications if we use it, all of that she will take us for a tour in the total parenteral nutrition. Followed by Dr. Muhammad Al-Sarhan, and he is the head of clinical and operational support pharmacy in King Faisal Hospital. He will tell us about TPN prescription, how to be precise while calculating. We all know that this is very critical. TPN, you should be precise. It's essential for meeting the individual metabolic needs and avoid any kind of complication. Energy, protein, carbohydrate, lipids, electrolytes, fluid volume, and monitoring. All of that will be covered by him, and he will be very specific in explaining each one of them. Going for the guru of the TPN, Dr. Osama Tabbara. He is a senior consultant pharmacist, president of the IVPN network. He will give us a TPN prescription, the art and the science of the peripheral and supplementary PN and ready-to-hang formulas. He will talk about them, what is the ideal for mild to moderate supplementary PN, ready-to-hang formulas, and why it is to be given, and what are the key signs for their initiation. From that, we go for week 4 in the second module, where we will have a case presentation discussion, case scenario, how to prescribe TPN and PN protocols. And then we will go for a TPN preparation for the second. After that, after the case presentation, we'll go for the second topic in the second module, which is the TPN preparation in adult critically ill. In week 5, that in the second module, we have TPN compounding and safety delivered by Dr. Argul Kozeglu. Sorry, she is a chairperson of the critical care in Turkey. And she will talk about the TPN compounding and how to that it should be, and very important that we have the proper training to use the appropriate equipment and what to use them, how to use them, all of that. Followed by Elizabeth De Waal, whom she is the head of Department of Clinical Nutrition in Brussels. She will give us and guide us about the PN feeding in special subcategories of critically illness, and talking in that she will go for the parenteral PN feeding, who are the people is indicated for that, where how early to start the PN and when it should be used cautiously. Going to our champion, Dr. Khalid Swaifi. He is the program director of the intensive care unit, nutrition ICU, ICN fellowship. And Dr. Khalid will talk about the types of lipid emulsion. He will talk about the lipids, and there are 2 types, the complex and these emulsions, and how to use them, what to use them, and what kind of details it have, and compounds and product it have, those emulsions, and the categories that based on them. From that, we go back to Professor and Dr. Osama Tabbara, who will give us the case presentation about ready-to-hang formulas in adult. From there, we go to the third topic, pediatrics and neonate, where we have Dr. Ali Al-Mudir will give us the talk about the challenges while you prescribing nutrition in the neonatal ICU, whom are very sensitive to deal with neonate. It's a very sensitive thing, and you have to be very specific, very precise. It is very crucial for those babies to have the proper nutrition and proper monitoring. The goal is to provide the optimal nutrition for them for the survival. In week 10, we go for our, again, my dear friend and speaker and supportive to MAPN, Dr. Faisal Al-Saheli, and he will talk to us about how to prescribe TPN in pediatric and neonate to ready to hang formulas. It is very important to know how to calculate the requirement, monitoring the growth, and biochemistry for all those nutrients case by case. Week 11, from that, we go for the PN feeding of special subcategories of critically ill pediatrics and neonate by Dr. Noura Al-Banyan. Sorry, she's a consultant clinical pharmacist in King Fahd Medical City. She will talk to us about the nutrition management for critically ill neonates in details, and when to initiate, what is the mood of feeding, the energy, the proteins, and all of that. Sorry, I was not well. Week 12, we go for the case presentation. Again, back to Dr. Faisal Al-Saheli, and he will give us how to prescribe TPN, PN, and their protocol. For that, we go for week 13, the semi-final assignment and the exam after the module 2. By that, we will go for the last module, which is module number 3, and it takes us for a tool about the ICN in specific circumstances. Started with week 1 in the module number 3, my hero, Dr. Mireille, Professor Mireille Caravetian, whom she will talk about the ICN in specific circumstances, nutrition in renal disease, acute CRRT, and post-renal transplant care. She will take us in how to manage the renal diseases in all stages and specific nutrition recommendation, which varies from one to another in different phases in different cases, and what is the nutrition. From that, I go to my friend Alessandro, Dr. Alessandro is an associate professor of medicine in the University of Rome, and he will talk about the nutrition in immunosuppressed patients, oncology, and post-transplant. Laviano will talk about how the nutrition focuses in preventing the foodborne illnesses, why it is very crucial to avoid certain food in the immunonutrition for those cases, and what type of food that it should be taken, and how what are the feeding to be taken. From that, we go for week number 3 in module number 3 with Dr. Liana. She is Anna Polia. She is an associate professor in the clinical and dietetics in Athens University, and she will talk about the preoperative nutrition, ERAS, in high-risk surgical patient. She will speak about how important that enhanced recovery after surgery protocols, and these protocols, why we need them, how to approach them for the care of the patient. From there, we go for the nutrition in sepsis and trauma and burn critically ill patients with Dr. Ines Migawer, consultant IM and endocrinologist, and she is in Al-Qasr Al-Aini Hospital, working on the oncology program. She will talk about the critical illness, how to start in those patients, and when to start the early enteral nutrition, parenteral nutrition, and the need for specific nutrients for those patients. From there, we go for a case presentation and discussion webinar with Dr. Midhat Shalabi. about ERAS. And by the way, I have to say something about Dr. Midhat. I started with him. He is the first one who started ERAS in the Gulf, and I was honored to be one of the people who was with him actually at the beginning. Until that, it's years back ago, until today, still ERAS didn't take the right, let's say, application for the sake of the patient's privilege. So I hope after you learn about it, we can convince people that it is really important to use ERAS. Going for topic 2, ICN in specific circumstances, we go for Dr. Ayman Morish, and he's the chairperson in the critical care services in King's College Hospital in London. He will talk about the geriatric nutrition in critically ill. What is different? And definitely it's different. In geriatric, it differs significantly than the younger adults. He will show us the requirement, why they need special nutrition intervention, and what are the factors that affect their decrease of lean body mass. From that, we go for Dania. She's a friend of mine. She's a senior clinical dietitian in Riyadh. She will talk about Dania. She will talk about nutrition planning for patients after ICU discharge, home, EN, and PN, ethical consideration in nutrition care for critically ill patients. She's very popular in this topic. She will talk about how to plan the nutrition after the ICU, what must be addressed ethically, and why we need the multidisciplinary team post-discharge. In week 8, the topic about nutrition and drugs interaction delivered by Dr. Janithi Vidyan, and she's a senior consultant nutritionist in enteral and parenteral, and she's the first president of the Indian Society of Parenteral and Enteral Nutrition. She'll talk about the drugs interaction, like juices, some vitamins, antibiotic, proper assessment and monitoring. From that, we go again for Dr. Ayman, who will give us a case presentation about the topic and about the session 1 and how it is this case study about those specific geriatric patients and what are the critical care that it is used. From that, we go for week 10, topic number 3, the last topic, in the module number 3, where the novel ICN approaches. In that, we have Rodrigo Mateos, senior consultant intensivist, who will talk about the assessment of nutrition adequacy and the role of new biomarker and the role of nutrition care team. He is from Portugal. And he will talk about the assessment or how to assess nutrition adequacy, the nutrition care team, interpreting biomarkers, personalized intervention, monitoring outcomes, and the interdisciplinary team, the need of it. If you remember, in all of them, we have said that we need the interdisciplinary. We go back to another close friend who is Hamda Al-Zuhair. She is senior dietitian, director of clinical nutrition in Saudi Arabia. And she'll talk about nutrition in neurocritical care and the role of ketogenic diet. She will give us the importance of ketogenic diets, which we all know it's just a high-fat, low-carbohydrate regimen. What is the evidence about it, when to be used, how to be used, and in critically ill patients, when it is beneficial, and what are the restrictions. From there, we go for Dr. Subhal Dixit, and he is from I think he is the critical care medicine, and he will talk about the feeding of the patient from India. He will talk about the feeding of the patients on MV and the important steps regarding nutrition in pulmonary critical care. And he will talk about those MV or the mechanical ventilated patients. What are the key nutritional tips in those pulmonary critical care, what to avoid, what to prioritize, when to use the energy dense low carbohydrate formulas, when to monitor, and what kind of close monitoring should be for those patients. From there, we go for my, again, dear friend. If you can see, all of them are my friends. Dr. Tariq Al-Musawi, he is a senior consultant intensivist in the Royal College of Ireland, associate professor, and he's from Bahrain. He will give us a message about all of what we have talked about by the latest news from Aspen, Canadian, and Australian guidelines. All of them, what kind of enteral nutrition, what kind of protein, what are the target energy, micronutrients, all of that. He will cover it in this topic from all the guidelines. In week 14, my sweet Dr. Dua Janina, she will give us a case presentation webinar delivered by her on those special case patients and what kind of solution we give in this discussion. We come to the final exam. See, I put for you all A+, which I wish for all of you the success in week 15 and week 16, which will be the final exam. By that, I end my talk. Thank you so much. And sorry for the coughing. I was not feeling well for the last few days. And hope that I give you the summary and my tour was beneficial. Thank you so much. I leave the floor now to my dear, dear friend, Professor Mireille Caravetian. She's a sister and a friend. The floor is yours, Mireille, and I will stop sharing. Thank you so much.
Thank you, everyone. Thank you, Dr. Khaled, for including me in this amazing fellowship. I really am enjoying my time in developing the whole program. And Dr. Wafa, you did such a good presentation of all the modules. I think it gives a very clear picture of what's next, even not just to the participants who are joining, but even for us. But because, you know, it has been being built as a puzzle piece, but now it looks like the puzzle is ready and it helps a lot. But I'm sorry that you were not well, so it was a lot for you. Okay, having said that, my role in today's lecture is to share with you the whole assessment, how the assessments are done and how lectures will show. So when you go to every module, you will be able to see 30 to 40-minute lectures. I will show you a tiny bit of that now in a minute, and it will be recorded, so you can actually like rewind it and forward it as many times as you want until you are fully comfortable with the topic. And then later on you will have 3 different assessments, and I will share small examples of those. So I'm going to share my let me see, share sound, yes. The video. So this is from Dr. Carla Prado, and I'm going to share a tiny bit of that. Please confirm that you can hear.
Hi, everyone. Thank you so very much for joining us for this presentation. I would like to thank my dear friend, Dr. Mireille. Global perspective. These are the learning objectives. We're going to be reviewing the role of muscle mass in the critical care setting, as well as summarizing body composition measurement techniques for patients in the ICU, as well as discussing some relevant aspects of body composition assessment for patients with obesity. So again, as I've mentioned, I'm going to use this umbrella term of sarcopenia and explaining why we use that as an umbrella term later on. So a body composition assessment is very important because it not only tells us about whether a person has.
I think you get the picture of the lectures, and as you see, the lectures, all of them have up-to-date references, and from those references we will develop some questions and multiple choice questions. And let me share my screen again, but now to my slides. So after you have the chance to attend and watch the lecture, Later on, it's a 30 to 40-minute lecture only. You will be able to get the chance to sit for a 10-question multiple choice question exam. There's one correct answer for each. And this is, for example, a question, which is, let's say, a 72-year-old woman with BMI is admitted after a fall, her gait speed, and so forth. But obviously, whatever is being asked has been explained in the lecture. Then after you watch the lecture and do the quiz, the 10-question quiz, then the next thing you will have, you will be given an article, a relevant article to the topic. And that article, you will have the chance to read it. Obviously, it will be a very up-to-date information from one of the references that has been used in the lecture, very relevant to the topic, one of the most important references that has been used in the lecture. You will have the chance to read it a little bit more thoroughly, and then that's the journal club, and you will be given the chance to sit for a 10-question multiple choice question exam again. This is an example of that. For example, which of the following best reflects the key outcome measures associated with low skeletal mass index in ICU patients? Again, it won't be extremely difficult for you to do because you've had a lecture on the topic and you have an article that this question is easily answered from that article. And obviously, you can always go back to the article, right? And then later on, once you're done with all these, now the aim of this whole fellowship is for you to be able to apply your knowledge in real life examples. So after the lecture and the article, you will be given the chance to sit for a 10 case-based multiple choice questions where you can apply your knowledge to real life clinical scenarios. This is an example where, for example, a 55-year-old male with acute pancreatitis undergoes a BIA, body composition analysis, in the intensive care unit in day 3. Due to extensive edema and shifting hydration, the results seem inconsistent with clinical findings. Which limitation of BIA most likely explains the discrepancy? And you will be given 5 choices. From the 5 choices, you will have to choose one. I think this is the sample assessment. All the modules will be following this format of assessments. And Dr. Khalid has to confirm on this. I'm not sure if one can take the exam more than once. I will need Dr. Khalid's intervention into that. Thank you very much. If you have more questions about the assessments, I'm here.
Thanks, Mireille, for summarizing the assignments, and now the door open for questions. So anyone want to? I answered many questions on the chat box, but still I can see 4 questions here.
Dr.
Can they-
Khalid, I have a
Yeah.
question. Can they be
Definitely.
will there be only one attempt per quiz, or they can attempt more than once the quiz?
They can attempt more than one. For people asking about group the discount, yeah, the company is our institute is allowing 25% for 10 people or above. So if you combine 10 people registration, you can get 25% in addition to the 10% on the whole module on the online. After completion of all modules, there will be a ceremony. Yes, definitely a ceremony decided on August. Is any online certificate? Yes, we get a very elegant certificate is from the American Association directly. It will be very, very nice certificate actually. What's the deadline for registration? Actually, next June 25, we are going to have induction meeting for the fellow. And after 1 week, we are going to start the platform. So yeah, try to make your mind before the beginning of July. Enrollment site, please, yes, in the chat box, you will find the registration link, payment link, and you'll find also the platform.
Dr. Khalid, what is the passing grade per 10 questions? How many questions should they be?
It's actually 50%. It should pass 50%.
Mhm.
The main concern, the materials will be present throughout the whole year, but the main concern is the performance will be followed up. So it's not allowed to really to delay the assignment for more than a week or two. You have to catch all the time.
Also, because the information would be fresh in their minds if they sit for the exam
That's right.
immediately after the lectures.
Any study material provided? Yes, we have the lecture, we have the assignment, and when we find the question, you'll find the answer explanation. So you will learn a lot after each week. I believe you'll be a very expert in the topic.
Yes, I forgot to mention that for each question, the answer will be explained and the reference will be put after it. And so if you wish to understand a little bit more, the deeper understanding of the explanation, you can refer back to the citation, to the article and read a little bit more, definitely.
That's right. Benefit for the fellowship, of course, you'll get a fellowship degree. The price online so far now 1,220 something like that, and if you going to use a 15% discount, it will be down less than $1,000 per whole module, 3 modules. So just take the chance of using these 2 days promo code.
Dr. Khalid, somebody's saying they've tried to pay, but it said payment denied. Who they can contact if that's the case?
Yeah, he can send to us an email and we can answer him. The email is present on the site, but I can write it back on the chat box. But this is the first time to find, because there is payment online with credit card. If you have a problem of paying by credit card, you can ask us, so the institute can send for you the bank accounts. You can transfer the bank account. How can this fellowship accredited by DOH so that it qualify for credit hours? The credit hours is the easiest thing. Is you send the American Association certificate, they accept it everywhere. So they give you the 96 credit hours. Material will be recorded, yes, recorded for throughout the whole year is present on the fellowship site. Week 1 class per week. You have 1 class in addition to the assignment, as Mireille mentioned, journal club, MCQ, and 2 case scenarios on each week. The exam online, definitely. Yes, we can do that. We will post the webinar on online. For the, I believe most of you are registered with us through WhatsApp or the Telegram, so we will post that recorded webinar on the Telegram.
Can you share in the chat, Dr. Khalid, the promo code? The
Okay.
webinar 15, is that what it is? Yeah.
Yeah, I'll
Yeah, I saw it in the chat online, sir.
So here in the chat box, you'll find definitely the registration link, the landing page, and also you will find up the webinar 15. When you pay at the end, put on the promo code, the webinar 15, you'll get another extra 15%. Code for 2 days only, yes. Can we get certificate for completing 1 module? You will do that, and you have a certificate from American Association also that you have 1 module. But I have a chat with many of you before. Better to get the chance of having fellowship. Why you get only 1 module? If you pay for 1 module complete, and you have a very respectable certificate in critical care nutrition fellowship, not just a module certificate.
Yeah. But I have explained that each module you will have a semi-exam, semi-final exam, and an assignments to be given, and then the final exam for the whole fellowship. So yes,
correct.
yeah. The 96 CME hours from USA, from the Critical Care Society.
Yeah, presentation will be on recorded mode. A lot of people ask about the module, as Wafa mentioned. Yes, per module you have different certificate. At the end, you have the full fellowship certificate.
That's why we mentioned after I spoke about each module, the ICN, then the GI, then the TPN, all of that. Each one of them it have its own assessment and assignments and exam. Yes.
How to divide the payment is clearly if you go for payment the payment link and you click it on, you'll have module one.
$480 per module.
That's right.
Dr. Khalid, can I share my screen and show them the registration page? Maybe that
Yeah,
would help.
definitely, please.
Yeah. So this is the registration page, which we have been showing. And see, for example, for the one who was asking, you can click on one module if you want, or pay full package. And then today's discount code adds another 15%. That's what Dr. Khalid was saying. But you can choose how many modules you want and pay only for that, or go for the full package. So I think it's quite straightforward. If you have questions, we're here.
How long is each weekly lecture? The weekly lecture is around 30 to 40 or 50 minutes maximum. Then followed by multiple choice, followed by journal, followed by MCQ, followed by 2 case scenarios. Yeah, we'll send the schedule timing on time. Yes, we have recorded lecture as we mentioned. Can we take fellowship face-to-face after finishing the module? I mean, there will be a graduation. There is a graduation online. You should have a bachelor degree for the people who are intern at the end of their internship. I think we have one talk to me about it, and I told her we can exceptionally accept, but she before graduation she should send the certificate, the internship certificate. 96 hours. So the whole fellowship is 96 hours. Yes, credited. Any other questions? So I think we can come to the end, and I hope the webinar will be of value for all of you. And still, we are available on the WhatsApp and on Telegram group and on the email. So if you want really any specific request, any specific question, please don't hesitate to contact us. I think now we can close. Thank you very much. Thanks, Mireille. Thanks, Wafa. Thanks, Dr. Thanks, Habiba.
Thank you so much. Good night.
And see you soon. And please just be with us throughout the year. You will win at the end. Bye-bye.